If you want to know how the prostate biopsy works, how it is done, the options, the complications of this procedure, stay here until the end of the video that I will show all this to you. I believe that this video will facilitate your understanding so that you can have a better recovery, so that you can be more calm and understand what is being done. The prostate biopsy is the only way to make a cancer diagnosis, but the goal is to exclude the presence of a cancer. So, when would the prostate biopsy be indicated? First, when there is a blood test change, the PSA test, or specific prostate antigen. Or also when there is a change in the rectal touch, which is done to see abnormalities within the prostate. And also when there is a change in a resonance test, which can often have been requested for another reason. Now, it is always good, I recommend, to do the resonance always before a prostate biopsy, because the resonance can help guide the biopsy. The prostate is a gland that is in the urinary system, but it is also part of the reproductive system. It is just below the bladder and in front of the rectum, of the intestine, of the end of the intestine. In the middle of the prostate is also the urethra, and it is also through the middle of the prostate that the content of the seminal vesicles passes. All ejaculation is eliminated through the prostate. The function of the prostate is to produce an alkaline liquid, to help the survival of the sperm, precisely for reproduction. But it can also grow over time, with age, and cause some urinary symptoms. In this case, the growth of the prostate is called benign prostatic hyperplasia. As the urine channel passes through the prostate, this growth can obstruct the urine channel. So, having the indication of doing the biopsy can be done in two ways. Transrectal, through the rectum, or transperineal. The transrectal biopsy is the most common. It is usually done with sedation, but it can also be done with local anesthesia. There is a probe, a kind of device, which is introduced by the anus, and inside this device there is a needle. So it is possible to locate the prostate very well, to map this prostate well, and then the needle is introduced. This needle is hollow, so the fragments of the prostate come along with the needle. In total, 12 fragments are collected. While the perineal biopsy, transperineal, is done through the perineum, through that skin between the anus and testicle. What changes between the two techniques is the transrectal biopsy of causing a sepsis, a slightly more severe infection, and this risk can reach 5%. That's why there is an antibiotic effect before this procedure. What can happen after the biopsy of the prostate? After the biopsy of the prostate, some kind of bleeding can occur in the urine, through the anus, or also in ejaculation. This is very common and tends to disappear over the course of days. There is no need to worry about it. The result of the biopsy comes out after 10 to 15 days, when the pathologist will analyze the fragments that were collected under the microscope. The pathologist will define whether it is cancer or not, and will give a grade to the cell he saw. The grade is considered the aggressiveness of the tumor. So the tumor can be more aggressive or less aggressive. This is important information for us to take some kind of conduct. In general, the biopsy of the prostate is a safe procedure, and it is the only way to diagnose or exclude the presence of cancer. I hope this video has been very useful for you. If you have any questions, leave them here in the comments. Your participation is very important.
Muito importante.